If you are over 60, small body changes can feel louder, and they deserve calm attention. Many serious problems begin with ordinary signs that look like indigestion and stress or simple aging. Today we will talk about pancreatic cancer warning signs in a clear, practical, and senior-friendly way. This video is not meant to scare you, but to help you notice patterns earlier and act wisely. The most important skill is not guessing a disease, but recognizing when a pattern repeats. Stay to the end because the symptom clusters can be more useful than any single sign alone. This video is for education only, and it does not replace medical advice or professional diagnosis. Only a qualified clinician can evaluate your situation, order tests, and interpret results accurately. If you feel severely unwell or symptoms are sudden and intense, seek urgent care immediately. If symptoms are mild but persistent, do not wait months because earlier evaluation protects options. Acting early does not mean bad news, but waiting too long can reduce choices. As you listen, ask 3 questions that are easy, honest, and helpful for older adults. Is this symptom new for me or clearly worse than my usual baseline in recent weeks? Does it last more than several days, or does it return again and again across multiple weeks? Is it showing up with other changes like appetite loss, stool changes, urine color, itching, or fatigue? One symptom can be noise, but several symptoms together can become a real signal. Before the full list, let's start with 3 red flag clusters that deserve earlier attention. Red flag cluster 1 involves bile flow, changes that can show up in urine, stools, skin, and itching. Red flag cluster 2 involves pain patterns that do not match typical reflux or ordinary muscle strain. Red flag cluster 3 involves early fullness, weight loss, and fatigue that does not improve with rest. If you recognize a cluster, you do not need certainty to schedule a checkup soon. Symptom 1. Persistently dark urine that stays deep yellow or brown despite normal drinking and routine hydration. If your urine looks like strong tea for several days, your body is sharing information. Urine can darken from dehydration, but it usually lightens quickly when you drink normally again. When urine stays dark, bile pigments may be leaving through urine instead of the usual pathway. Some people notice the color is darkest in the morning, but it remains dark all day. Some people notice stronger odor, mild foam, or a sudden change that feels clearly abnormal. Dark urine can also happen from vitamins, certain foods, and some medications, which is important. That is why persistence and context matter more than any single bathroom visit on one day. If dark urine lasts more than a few days, schedule a checkup instead of waiting for weeks. If dark urine appears with fever worsening, pain, confusion, or weakness, seek urgent evaluation quickly. Symptom 2. New yellowing of the eyes or skin or itching that spreads and becomes hard to ignore. Itching that interrupts sleep is not always dry skin, especially when it is new. Yellowing often begins subtly in the whites of the eyes under indoor light or morning sunlight. Skin may look slightly golden dull or different in tone, and family may notice first. Itching may be widespread, persistent, and surprisingly intense, sometimes worse at night for seniors. Some people scratch until the skin becomes sore, yet moisturizers and antihistamines barely help. These changes can have many causes, but bile flow issues are one important reason. Yellowing and itching are especially concerning when they appear with dark urine or pale stools. If you notice new yellowing, call your clinic promptly, rather than treating yourself for weeks. If yellowing comes with fever, severe pain, extreme weakness, or confusion, seek urgent care immediately. Symptom 3. Pale, greasy floating, or unusually foul-smelling stools that persist or keep returning over time. It feels awkward to mention, but stool changes can be one of the clearest clues. Your pancreas supports digestion by releasing enzymes that help break down fats and proteins. If enzyme flow is reduced, fats may not be absorbed well and can pass into stools. You may notice stools look lighter, clay-colored, or simply much paler than your usual. You may notice stools float more often, look oily, or leave residue that is hard to flush. You may notice a stronger odor that feels unusual and not explained by recent meals. Some people notice bulky stools, looser stools, or frequent urgent trips that disrupt daily life. Stool changes can also happen with gallbladder disease, liver issues, infections, or diet changes. So, the key is persistence plus, whether it appears with weight loss, itching, or appetite drop. If stool changes last longer than a week or recur frequently, discuss them with a clinician. If you notice black tarry stool or bright red blood, seek urgent care right away. Symptom 4. Upper abdominal pain that feels deep and may radiate into the back, especially after eating. Pain location and timing often matter more than pain intensity for older adults. This discomfort is often described as a dull ache deep in the upper belly area. It can spread into the back, creating a band-like pressure across the torso. Many people notice it worsens after meals, particularly heavier meals or high-fat foods. Some people notice the pain worsens when lying flat and improves slightly leaning forward. It may start as occasional episodes, then become more frequent and last longer over weeks. Because many seniors already have back pain, this symptom can be blamed on arthritis too quickly. A useful clue is whether the pain changes with meals posture or becomes constant over time. If pain persists, intensifies, or disrupts sleep and appetite, schedule evaluation rather than enduring it. If severe pain comes with vomiting, fever, fainting, or rapid worsening, weakness, seek urgent care. Symptom 5. Persistent bloating, tightness, or early fullness where small meals feel like too much food. If 2 bites feel like a full plate, your digestive system may be struggling. Bloating can feel like pressure under the ribs, swelling, or tightness that lasts all day. Some people feel uncomfortable after a few spoonfuls, even when they are hungry. Some people feel their abdomen is tense and heavy, not just after meals, but throughout the day. Common quick fixes like antacids may not help much, which is worth mentioning to your clinician. Early fullness can occur when digestion slows, inflammation rises, or nearby structures are affected. This becomes more concerning when it is persistent, progressive, and linked with appetite loss or weight change. If you are skipping meals because you feel full too quickly, you deserve a medical conversation soon. When you describe it, share what portion size triggers it and how long the discomfort lasts. If early fullness appears with pale stools, dark urine, or back radiating pain, act sooner, not later. Symptom 6. Ongoing digestive upset like nausea, vomiting, heavy stomach, discomfort, or a noticeable drop in appetite. A sudden appetite change can be a real signal, not just a mood or aging issue. Some people feel nausea that lingers for hours, especially after meals, even small meals. Some people feel food sits like a stone with discomfort and burping that seems unusual. Some people vomit after heavier meals, or feel queasy when smelling foods they once enjoyed. Older adults may also notice new intolerance to fatty foods, leading to avoidance and poor nutrition. Digestive upset can come from reflux, ulcers, gallstones, infections, or medication side effects. That is why duration and progression matter, especially when symptoms persist beyond a short illness window. If nausea or appetite loss continues for weeks, do not self-treat indefinitely without medical guidance. If vomiting is repeated and fluids cannot stay down, dehydration can become dangerous in older adults. If digestive upset combines with weight loss, stool changes, or jaundice signs, schedule evaluation promptly. Symptom 7. Unintentional weight loss, especially when clothes loosen and strength declines without a planned diet. Weight loss feels positive until it happens without choice control or a clear reason. Unintentional weight loss can occur when appetite drops, digestion changes, or inflammation increases quietly. You may notice your belt needs a new hole, your face looks thinner, or muscle feels weaker. In older adults, even modest weight loss can reduce balance, increase fall risk, and slow recovery. Weight loss is more concerning when it appears with early fullness, nausea, or changes in stool. It can also appear with uncontrolled diabetes, thyroid issues, depression, or other medical conditions. So, The goal is not to guess the cause, but to treat unplanned weight loss as important information. If you can note how much weight changed and over how many weeks or months, bring that timeline to your clinician because it helps them decide what tests are reasonable. If weight loss is rapid or you cannot maintain nutrition, seek evaluation sooner rather than later. Symptom 8, fatigue and weakness, that do not improve with rest and make everyday tasks feel unusually hard. Normal tiredness improves with rest, but warning sign fatigue often refuses to lift. You may feel exhausted after small tasks like showering, cooking, or walking short distances at home. You may nap more often, yet still wake feeling drained, foggy, and unsteady. Some people notice stairs feel harder, groceries feel heavier, and motivation fades because energy disappears. Fatigue can come from anemia, thyroid problems, low mood, sleep apnea, infection, or medication changes. So, fatigue alone is not a diagnosis, but fatigue with other symptoms should raise attention. If fatigue is worsening over weeks, ask for evaluation because basic tests can reveal treatable causes. If fatigue comes with chest pain, severe breathlessness, fainting, or confusion, seek urgent care immediately. If fatigue appears with appetite loss and weight loss, do not assume it is just age. The earlier you evaluate persistent fatigue, the faster you can address the true cause safely. Important warning section. Blood clots can be overlooked, but they can be life-threatening and need urgent action. Sometimes the most dangerous sign is not in the stomach, but in the leg. Certain illnesses can increase clot risk, leading to deep vein thrombosis in the legs. A clot in the leg may cause swelling on one side, warmth, redness, and calf tenderness. Some people notice the leg feels tight, heavy, and painful when standing, walking, or bending. If part of a clot travels to the lungs, it can cause a pulmonary embolism quickly. Warning signs include sudden shortness of breath, chest pain with deep breaths, fast heartbeat, or fainting. If those lung symptoms appear, treat it as an emergency because minutes can matter. If you have unexplained one leg swelling without injury contact, a clinician promptly, even if the pain is mild. This section is not meant to frighten you, but to prevent a delay when action is needed. Knowing these signs helps families protect older loved ones, especially when symptoms are minimized. Now, we will connect the dots because symptom clusters are what most people miss completely. One symptom can be noise, but a cluster can be a clear signal. Cluster 1 is dark urine plus itching or yellowing, often appearing within the same time period. Cluster 2 is upper abdominal pain radiating to the back, plus early fullness and appetite loss. Cluster 3 is pale or greasy stools, plus unintentional weight loss and ongoing fatigue. Cluster 4 is one leg swelling, plus sudden breathlessness or chest pain, which is an emergency cluster. Clusters do not confirm cancer, but they strongly suggest you should not delay proper evaluation. When you bring clusters to your clinician, you give them a clearer map to work with. A clearer map often leads to faster testing, faster answers, and better decisions for your health. Here is what to do today, using a simple 3-level plan designed for seniors and caregivers. You do not need perfect certainty to take smart protective action. Level 1 is a mild single symptom that improves quickly where brief observation is reasonable. Level 2 is 2 or more symptoms lasting weeks where scheduling a medical visit is the best step. Level 3 is severe pain, vomiting, jaundice, confusion, or sudden breathing problems where urgent care is safer. This plan protects you from ignoring real issues and from panicking over ordinary short-lived changes. If you are unsure which level fits, choose the safer option and call your clinic for guidance. A symptom journal can help doctors help you faster, and it is very senior-friendly and simple. A few clear notes can save you weeks of guessing and unnecessary suffering. Write when each symptom started, whether it is constant or comes and goes, and whether it worsens. Note whether meals trigger it, whether posture changes it, and whether sleep is affected at night. Record stool changes, urine changes, itching severity, appetite level, and any weight changes you notice. List all medications and supplements, especially new ones, because they can affect digestion and urine color. Bring a trusted family member if possible, because extra ears help when you feel tired or anxious. If you feel embarrassed discussing stools or itching, remember, clinicians hear this every day professionally. Your job is not to be perfect, but to be honest and clear about what you are noticing. Gentle reassurance matters because fear helps nobody, but clarity helps everyone take good action. Many people with these symptoms do not have pancreatic cancer, and that is important to say clearly. Gallbladder disease, liver conditions, reflux, ulcers, infections, and medication effects can explain many signs. Early evaluation can identify treatable causes sooner, and it can relieve worry with real answers. Delaying care rarely helps, but timely care often provides options, comfort, and peace of mind. If you recognize yourself in this video, it does not mean bad news. It means be proactive. Closing message for adults over 60 who want independence, clarity, and a calmer relationship with health decisions. Paying attention early is not fear, it is wisdom and self-respect. If you found this helpful, please like the video and subscribe to the channel for more senior-friendly guidance. If you want a simple printable checklist, comment the word checklist, and we will summarize the key points. And if you recognized a cluster today, consider scheduling a checkup sooner rather than pushing it away. You deserve care that is timely, respectful, and based on evaluation, not guesswork alone. This content supports awareness and conversation, but medical decisions should be made with professionals you trust.